Yeah,
Thank you for the picture, by the way.
yeah.
We'll call the finance meeting to order. Roll call, please.
Pat Kinney,
Here.
Blake Ellefson,
Here.
Dick Pufall.
He's
Dick
here.
Pufall. Brad Ray,
Here.
Ron Stendor,
Here. Thank you. Next, number 2, approval of the agenda.
Brad will make a motion to approve the agenda.
Ron Stender will second.
Mr. Chairman, can I make a request?
Yes. Yes.
I'd like to request that we move public comments to after 5A.
And the rationale?
The rationale is that way we have a discussion of the health insurance plan and try to answer everybody's questions beforehand so we don't get repetitive questions or possible misinformation. And then we can take questions afterwards and make further consideration.
So if we do that, so I talked to the administrator yesterday, so trying to cover a lot of ground with the most common questions that would be anticipated. That way we can get through those first. And then if the committee so chooses, we could recognize members of the public, which includes employees, if there are specific questions that we want to recognize during the discussion on healthcare, the committee could do that also. And then if there are questions after that in public comment, we could make note of those, and that gives us between now and the budget meeting or the county board meeting, October 29th, to look into those questions also. So we had a motion and a second to approve. Is there anyone to consider an amendment to that? Blake?
I would like to make a amendment to move public comments after the discussion 5A.
Ron Stender will second.
Any further discussion? All in favor?
Aye.
So then moving to number 4, approval of the minutes.
Brad Ray will make a motion to approve.
Ron Stender will second.
Any discussion? All in favor?
Aye.
Aye. Opposed? Motion carries. Thank you. And then next, we will move to the health insurance update.
Okay, first off, to the members of the committee, when you're speaking, could you please make sure you turn your microphones on? Move the microphones closer to your mouth, so it's when the microphone's away, it's harder for people to hear you. So,
Would you project the first document there?
yeah.
So when we looked into switching to the state plan, the state has a surcharge. In the first year, they call it 30%. In the second year, they call it 15%. But it doesn't turn out to be exactly 30 and 15%. So I asked the administrator that, and his explanation from the state was because employees can choose the plan they want, it doesn't turn out to be exactly 30 and 15%. What it turns out to be is $300 per month on a single contract and $750 a month on the family contract in the first year.
Right, and that's for each contract. So each individual is a contract.
Yeah, each individual is a contract. And then the second year, it would be half of those amounts that we see there. So if you're looking at the rates and it says 130%, that's not exactly 130%. You would be using these numbers.
And so how that's figured out is you take the rate based on the state maintenance plan, because that's the maximum share that 88% of the state maintenance plan is the maximum share the county is allowed to contribute to health insurance by state statute. So the county share is fixed, basically. So you would take the total premium and add either the 300 or the 750, depending on what contract you are, multiply it by 0.88, that would get the county share. And then the balance for whichever plan you choose is the employee share, which is why you see the $400 and the $1,000.
So by state statute, the most the county can contribute is 88%, which is what the county is proposing. Under the current plan, the county is paying 90%, but 0.88 is the most that we can contribute to that. The other thing of note is that the state plan will include the dental. And so the county will be paying 88% of what goes towards the dental, whereas now the employees are covering that entirely on their own. So we'll start with that document going. Are there any questions or comments on this? Let's go to the next document.
So this is for the state maintenance plan. Everybody received the same document in the mail for all the other plans. So you can check your emails for that. So for every plan, all four options, the deductibles are 500 for an individual, 1,000 for a family. All right. The biggest difference between all four options is how big your network is. So the state maintenance plan includes Tamarack, Essentia, Duluth, St. Luke's, and I believe St. Luke's Duluth. So that all those providers and basically any provider in this area in the First Health Network. And I want to First Health Network, which is currently our current network. So you should be able to keep your doctor because they're in the First Health Network in this area, they would still be covered under the state maintenance plan. The other plans have a wider reach. So if you really want to make sure Mayo Clinic is in your network, there is a plan that includes Mayo in it, but that plan does cost more money. If you want to make sure Marshfield Clinic is in your network, there is a plan, but it costs more money. So the other plans just really expand your network. Is a big difference between them.
So a question on providers. We're in the northern end of the county, obviously, and half the population is in the city of Ashland. And so this is where most of our medical services are. What does the state do in cases of counties such as this one, where you've got a lot of population and medical services on one end of the county? What about the employees on the other end of the county who might be closer to a provider further,
Like
out
in
of
Price County.
Pardon?
Like in Price County.
Like in Price County, or just in general isn't unique, but then what?
All right. So it's my and I'm gonna have to check this with ETF just to verify. But it's my understanding that the plans are based on the county you live in and that you work in, so that your employer's in. So you'll be going to providers available to that county. So you'd be going to providers available to Ashland County employees. Price County would have their employees would be able to go to providers in the Price County section. But I'll have to check to see whether or not they can go to, and those who live in the southern part of the county can also look at the provider list and see if providers in Park Falls are covered. But I'd have to check to make sure.
Okay.
Okay,
Um,
and that's my question, because we have at least 6 county employees who are looking at this. And Dan and I have talked, but I will be an advocate for this change, because when I worked as a state employee, I was allowed to take a Price County plan. Now, local employees may be different, but the argument's the same. We are not going to have employees at the southern end of the county driving 50 miles when they can go 6. And so if we need to, we will talk to ETF and ask them that question. I know the answer at first will be, you got to stay in the county, but that has already been deviated for state employees. There's no reason why a county employee couldn't take advantage of it. If they don't want to take Security Health, as an example, out of Price County, and they should be able to, as long as they're paying the premium on it, or, whatever that premium is. So I'll work with Dan and
Yeah.
we'll figure it out, because like you say, we have at least 6 county employees who are seriously thinking about that Price County plan. And when you live that close, in my case, I was 6 miles. It didn't make sense to come to Ashland.
Right.
And it does make sense for them to change all their doctors if it doesn't affect the county's cost at all, I will advocate to try and get the state to address that issue.
Yeah, we'll start with that and then,
Yeah.
Right.
and
And we'll have to do this quick because
So,
the,
so I'll call them after the meeting.
right, because the open enrollment ends the end of the month.
Right.
So, thank you.
Mr. Kenny?
are you done with what you want to go through there for the moment?
Yeah.
Any que-
So the out of network maximums are 5,000 and 10,000 for all the plans. So these numbers don't change for the plans. The biggest issue is going to be, you'll find it's later in here. In the max out of pay after your deductible only applies to emergency room visits and durable medical goods. So that's things like wheelchairs and crutches and that kind of thing. Things you buy at a medical supply place. And obviously the out-of-network costs are more expensive. The one thing I guess we should explain to people is the reason why insurance companies do this in-network, out-of-network is to contain costs. That's how they make their money, by controlling costs. They take less you pay out, the more you make, basically. So every insurance company cuts deals with health insurance companies. And I'm going to say companies, that means Essentia Health, Tamarack. Those are, or Security Health, or whomever, Mayo Clinic. Those are health insurance companies. The insurance cuts deals with them. Now, just because they cut a deal with, say, Essentia Health doesn't mean that all the doctors in that company are in network. Some doctors they do keep out of network, and that has to do with their own internal issues, whether or not they make more money off a certain doctor than another. So that is it, and that's true of every health insurance. So here we go to that max out of pocket I was talking about. The $9,200 and $18,000, that again, that applies only to emergency care and durable medical goods. It does not apply to general care. Ambulances are paid for, which is great. Also, I should note, no matter what plan you choose, emergency room care is covered as in-network no matter where you are in the country. So if you go to Florida and you have to go into the emergency room because you hurt yourself, that's considered in-network. If you go to Florida for a knee replacement, that's out of network. It has to be emergency care.
What if someone goes into urgent care?
Urgent care and emergency care are generally treated the same.
Generally treated the same?
Yeah, and most insurance companies would rather you go to urgent care because it's cheaper than emergency care.
Okay.
So chiropractic care, I mean, these are ear implants, diagnostic tests. I mean, they're all covered. Zero co-insurance, which is nice. Again, here's that durable medical good thing. So again, here, emergency care is covered. Here's your urgent care. You pay in-network deductible, then 0% co-insurance. And they want you to seek it whenever it's possible. So that is covered as in-network care. Hearing aids for children are covered. Home health care, if you have to stay at home or because of an injury or surgery or whatever it is covered. Inpatient network is covered. Again, in-network care is covered. So that means if you're at Tamarack or Essential St. Mary's, you're covered. Or if you choose one of the other plans, the more expensive plans, you are covered if you're at Mayo or if you're at Milwaukee Children's Hospital or UW Hospital. Mental health is covered, which is a big one because a lot of insurance companies don't like to cover mental health or cover it very sparsely. Occupational, physical, and speech therapy is covered. Now, I know there's an issue out there about what physical therapists are available locally. We do have one employee that was looking for that answer. And so when I find out that answer, I will send an email to everybody again. And I might want to make a comment about the emails. I've been sending when we get the answer to the questions, I've been sending everybody the same thing, the exact same information. That way there's no, well, I heard this, I heard that. Everybody's getting the exact same thing. And I think I personally think that's important because then there's no ambiguity. You don't hear what you want to hear or see what you want to see. It's right there for you. And every employee can say, well, no, that's what it says right there. So with this physical therapy part, like I said, we had one employee contact some local physical therapists and to ask them directly if the state maintenance plan covers them. So when I get the answer to that, I will tell everybody. Again, so outpatient care, cardiac care is covered. Again, hospital and surgery, preventative, and all the things that are required under the Affordable Care Act. Primary care covered. Again, skilled nursing, telemedicine in certain situations. Telemedicine is legal in the state of Wisconsin. In some states it's not, but in Wisconsin it is legal, and it will be provided, but only in some situations. And again, that's the e-visit stuff. This happens a lot with mental health care because there's so few providers that you have to see somebody in Superior, and so they have a secure Zoom link where you can see somebody. And again, they're talking about telehealth, telephone visits, remote, it's all the same thing. Vision services, so this will be for medically necessary items. Things that would not be covered under this. Again, here it's to diagnose and treat diseases and conditions of the eye. So that's medically necessary items. So somebody who is a diabetic and has to have their eyes tested every year because diabetes can screw up your vision. That's a medically necessary test, and that's covered under health insurance. You would not need to buy vision insurance. And then they go over some other end items. And this dental implant thing is a big one because that's not covered by a lot of insurances. Or they make you pay for it in your dental, and then you end up having large copays. But hearing aids are covered, but there is a 20% co-insurance. That's a big one. Hearing aids cost $4,000 or $5,000. I'm not sure what temporal these joint disorders are, so I can't answer that. So dental, there's several plans of dental you get to choose from. When you get the insurance, you get preventative dental. That's basically your yearly checkup, teeth clean. If you want, It's not in this, it's not in this one. It's in the schedule of benefits, I believe, or no, it's in the decision guide. The different. So we'll go to the decision guide because this, and again, we are only talking about the state maintenance plan here. Each other plan has a different decision guide, and that was emailed to everybody. And I'm sorry, let me move this thing out of the way because it's hard to see. So this goes through a lot of the information, but it's similar. I'm going to go here. So, this is like this is the state maintenance plan. This is the other three plans. The nice thing is you still have pharmacy nationwide in this maintenance plan. So again, here we go to the basics. Deductibles are 500 for a single, 1,000 for a family. That's for all four plans. The max out of pocket is 9,200, 1,840, 400, but again, it only applies to durable medical goods and emergency room copays. So if you go in and have, use knee surgery again, your max out of pocket is going to be $500. If you go in and get a knee surgery and then you need a wheelchair afterwards, you will have to pay for the wheelchair up to 9,200 or 18,400. So you, again, there's the different, again, co-insurances, $0 on preventative care. I should note that's required under the Affordable Care Act. Telemedicine is covered. All your doctor's visits are covered. Urgent care, Mr. Kinney, is covered 100% into your deductible. Again, because that's cheaper than emergency room care. Emergency room care is $60 plus whatever deductible you have left. So if it's January 2nd and you slip and fall on the ice, you pay, and your hospital bills $1,000, you're going to pay $560. But then you have no more deductible after that for the rest of the year. Now, if you slip and fall on the ice again in March, you're going to pay $60. So,
Dan,
yes, sir.
if you go into the hospital, you don't pay the 60.
For the emergency room, you do.
Right, you don't pay the emergency $60 if they admit you to the hospital.
Right.
It's waived,
Yeah.
so it'd be $500.
Yeah.
Okay,
So then the hearing aids, again, we went over that. And this benefit guide for everybody is really where you can get the easiest, most digestible form of information. So pharmacy costs. So earlier, a couple of weeks ago, I sent everybody a link to ETF where you could type in the names of your whatever drug you might be taking to see whether it's covered and what tier it's at. I know some people were typing in name brand for drugs and it was coming back not covered. If you went back and typed in the generic version, it was covered. So those of you who think you have drugs that are not covered, go and check the generic version first. If you're not sure what the generic version is, just Google the name of your drug and it will tell you what the generic version is. Or ask what's the generic version of, I'm trying to think of a drug. Like, all right, Lyrica just recently went on to generic. So what is the generic version of Lyrica? And then Google that name into the thing and you'll get a different answer. There are some drugs that are not covered. That's true of most health plans. And these are usually very high cost drugs that cost $10,000 a month, or drugs that are experimental, or the data is not out there to prove the effectiveness. is better than an existing drug or therapy. Like most health insurances, they want you to try the cheaper options first. So they want you to try drug A first to see if that's effective. Or they want you to try, if that isn't, they want you to try drug B first to see if that's effective, and so on. Now, many of you probably who fit this category may have tried those treatments already and they didn't work. That's also true with brand name and generic. There is slight differences between brand name and generic, and for some people, you have to have the brand name because the generic just doesn't work, even though they are bioequivalents. It's just something that happens. There is a waiver for that, and I sent everybody that form too. You can your provider can certify that they've tried all the cheaper options first and submit the form to get an exception to get the ones that are not covered. The key is you can't do that till January 1st. So you actually have to be on the plan started before you can seek the exemption. And that will all be done through Navitus. Now, if you get that exemption for drug X, it's going to come from the UW specialty pharmacy. So it'll all be mail order. But you're getting, or Navitus may find a cheaper option. Navitus is the pharmacy provider, like Scout RX is for us now. Now, they may decide they know a cheaper option than UW pharmacy, and they'll get it from there. But in general, it's going to come out of UW. So there are out-of-pocket limits to prescriptions too. So as a single, you'll never, for most drugs, which are most generics at level 1 and 2, the highest you'll pay is $600 and $1,200. Level 3 and 4 drugs, again, are those very high priced drugs, but are still in the plan. And of course, you can use ServURX for mail order drugs. That shouldn't be a surprise to people how that works. Up until last year, we had ServURX as our mail order provider. It's going to work the exact same way. As until Amazon takes it all over, but we don't need to worry about the Medicare stuff. I will note though that if we move to this plan and then you retire in a couple of years, you can continue with this plan as a retired employee. And then once you're Medicare eligible, you can continue with the plan as a supplemental to Medicare. So that's a benefit for people. But I'm not going to go over the Medicare stuff because most of us are not Medicare eligible. So this goes to the question Chairman Mertig was asking of what plans we have available to us, and it's these. Now, if we look at Price County, Pierce.
On the right.
So they have 2 different plans available to Price County employees. So the question, so they can't really, I don't think the state allows you to do the Aspire Social Security Health Plan. So the question is, are the providers they have in Park Falls, are they covered under the state maintenance plan? That's the question that's the big question.
Most of the 6 employees would, I can't speak for them personally, but most of them would probably be looking at Security Health because that's the Marshfield plan. But
Well, we have a plan, there's a plan available to us that covers Marshfield also. And the Security Health plan is going to be just as expensive as the plan that we have available to us.
Right, and that's the question they need answered.
Yeah.
Thank you.
And then just keep going through the counties. These premiums are not really relevant to us right now because we have the surcharge. We don't care about the Medicare ones. Okay, so here's dental. So the uniform and preventive plan is what everybody would get with the healthcare plan. Now, some providers, and this is dentists, making their own choice because dentists are private practitioners. They're not like Essentia Health, where the doctors are employees of Essentia Health. Dentists are their own private small business. They get to pick and choose which kind of insurance they want to take. Of course, it's no surprise dentists choose the insurance that gets them the most money, which is what all small businesses try to do. It's why they're in business. So you may have, if you choose the most basic plan, Green Branch Dental is the only one included. If you choose a different plan, you'll find that there's 10 providers listed. And I believe I saved and I'll show you what I'm talking about. Let's see. Let's just try this. Is it this document? I saved a document that had the dental information in it. Let's see, it's on M3s. Was it template 6? I don't know. Okay, I'm sorry, I don't know what the link is. But anyhow, so you have to select a different dental plan if you want to use Lakeview Dental or Babe Dental or whatever it is. There's also ones available in Washburn and Bayfield under the other plan. But it's in that link, and then it brings you up to a screen, and then on the right hand, you have to put the zip code in and how many miles away from the zip code. And then you have to, there's another button on the far right you have to click to give you whether it's a PPO or a PPO Premier or it's like, oh,
I can give you the website,
do you have it off hit?
www, the number 4 dot Delta Dental Wisconsin .com. www and then the number 4, then
Right.
period, Delta Dental WI.com.
That's it?
Yeah, should be.
Provider search. Okay, so this is the screen you'll get. So if you type in the zip code, it's going to say Sanborn, but we'll say within 20 miles, find providers. So if you have the plain PPO, you'll find that Green Branch are the only providers available. But if you click here and go to Delta Dental Premier or Delta Dental PPO plus Premier, I'll do that one because that's what's on this screen right here. Search again, and you'll see Lakeview Dental. I forget the Bay Dental. You'll see that there's a whole bunch of options here. There's 10 of them. And you can even say within 50 miles, And then you get even more options. So and then it keeps going. So you'll start getting the dentists in Superior and Ironwood and so you do have to, everybody has that link in their email. You just need to make sure that you click this button right here. And if you don't find your dentist, go down to the different one. And I know that's a problem because Green Branch is impossible to get into. You have to wait at least a year or more to get in there. And I know people have just been seeing other dentists. And they have established relationships. Now, the thing is too, it's also, you get different benefits with each of these plans too. Your deductible changes, your max benefit. So if you want crowns, if you have somebody who needs crowns or orthodontics, like my son has braces in his first year of 2 years of not having fun. I personally gonna go for a higher plan because it's gonna cover more of his braces. So I'll make my money back. The reason why it says no coverage here is because everybody gets the basic coverage, where the cleaning, while the preventative stuff is. And then you get different percentage of different everything here. See, if you have crowns or bridges or implants, it's going to cover different amounts depending on what your needs are. So I know this part's confusing, but it's because, especially this one, the basic treatment, because you get this comes automatically. And if that's all you want, then that's fine. But if you want the other stuff, you have to choose a different plan. And again, that's and I want to make a comment here because I know there's a lot of angst about the different options and what to choose. None of us in this room can make that choice for you. It's a decision only employees can make individually based on the needs of their families and their own risk tolerance levels. So you have to look at what do you think your family needs? Like I just gave an example. My son has braces. I know that I'm going to choose a higher option because he has braces and I can get insurance to pay for a lot more of it. So that's a need my family has.
Yeah. Just that basic coverage, you said and basic coverage is just a couple of teeth cleanings a year and basic x-rays. That's kind of limited. That's included in the plan.
Right.
The other two are additional costs to the employees. The first one, runs whatever, and the second one runs a little more.
Yeah.
I have those plans. I get a different rate than we will get simply
yeah.
because the retirees get a lower rate, but it probably runs about $80-90 for that first plan. So the county's going to cover that, or it's in the plan.
It's in the plan.
Okay, so then if a county employee wants additional coverage, they will pay whatever those two cost.
Right.
I know I can't say this for county employees, but I have the middle one and I'm paying $31 a month for that. I'm not saying that's what it's going to cost.
No, it doesn't.
Because everybody's on a different system here, but, and then the select plan plus is a little more. I don't know I didn't bring that copy, what that costs, but so the employees know. The first one's going to be covered. If they want those two additionals, they'll pay whatever that current rate is.
Right. And again, that's what you choose is based on what your family needs. If nobody in your problem has dental issues and you just need it, then you might want to not choose the higher problems. If you know you're going to go in and get some crowns, then you're going to want to pick a plan that covers that more. If you know, again, that you have a child getting braces, you're going to want to pick a plan that covers more just because.
This is Blake. Just had a question. So the uniform dental and preventative plan, that will cover all those providers, even if they're non-Green Branch, right?
No, they have to be Green Branch.
So,
That's going back to this.
so really Green Branch is the only one that we can give them any coverage on the preventative?
Locally, if they're willing to travel, like North Lakes and Iron River is covered. There's somebody in Hurley, Ironwood, Namacoggin. So there are other covers. There are other doctors, dentists that are covered, but they're just not in Ashland. So the closest one would be Iron River.
So what you're saying is if I got a dentist that's not Green Branch today and I can't get into Green Branch,
Right.
I can't get any of the preventative stuff covered? Like the,
Unless you go to Iron River.
okay.
So, but again, you have to choose what plan suits your family's needs. And the same goes with health insurance too. You have to choose what your family needs and what your risk tolerance is. I know for a fact there's like 1 or 2 employees here that insist on having Mayo Clinic in their coverage. So they would have to choose a plan that has that in there. But that's a choice they make based on the needs that they have and their risk tolerance. Vision insurance. This is optional. You don't have to take it. You can just say no to it. I could tell you locally, North Lakes is covered under vision. And they will pay, they'll make these pay. They'll pay $15 a year. You pay $15 for an exam that normally costs $125. Or at least that's the last time what it cost when Liam went. So, you know, there's a zero copay on frames. You know, $25 for the lens. And then depending on what you want to get, you know, everything is covered. The premiums are based on, again, individual plus spouse or family. I know I'm going to be getting vision because my family needs it. My son has glasses, and frankly, I probably need them too. So again, that's a choice we're making because our family needs that. If your family doesn't need that, you can opt out of that. And then there's accidental insurance too. You can choose. Again, that's optional. If you think if you're clumsy, you think you're gonna fall on the ice every summer and might need it, well then you can get covered for it. Or if you're just afraid of having an accident of some sort and you can get this coverage. Again, this is optional. It's based on what your family needs and what your own risk tolerance is. And then the rates are here. Vaccinations are free. I will say a lot of these you can get it at public health also. And public health would just bill the insurance like they do currently. These are also vaccinations that are required under the Affordable Care Act. And just so everybody knows, for those employees around, there will be flu vaccines in this room after this meeting. So then they talk about some mental health stuff. And so all 4 plans have a guide like this that goes through all the information. Everybody has copies of all this. And I encourage you to go through it and choose, and you would choose, again, the plan that fits your family's needs, that suits your own risk tolerance. Some people may feel that they have to have coverage if they're traveling out of the country, or in the country, I should say, I'm sorry. They go to Minnesota all the time, or they go to Illinois all the time because they have family there, they feel that they need coverage there, then, you can get that. So, another thing with the state maintenance plan, we did get a question about children. And I have not received an answer yet from ETF, but I'll tell you the answer that I think it is, based on my conversations with HR at Bayfield County. If you have a child that lives outside the network area, but they're under the age of 26, so they can be under your insurance, under the Affordable Care Act, that's allowed. If they would either have to come back to the network area, so that could be here, that could be Duluth. This is for a state maintenance plan only, again, to be in network. Otherwise, they would have to go to another state maintenance plan county to get covered. So, like if you have a child at UW-Madison, Dane County doesn't have a state maintenance plan because they already have Meriter and UW hospitals and all that stuff that are covered under the plan. But I will say, at colleges, most major colleges have healthcare centers. They have clinics for students to go to free that will cover most general preventative care. And that's paid for by the students in their tuition. I know for a fact UW-Madison has it because my wife used it all the time. So there is that. I am confirming that with ETF. They have not gotten back with us, but that's the answer I got from Bayfield County. So, can I get some questions from board members?
Could you go back to the dental plans, the choices there?
Yeah.
So I'm looking, and could you scroll out just down a little bit, or up, I'm sorry, up, my other up. So as I'm looking at those, this is a question I'm going to ask the administrator and chair. We're going to have to do some looking outside of meeting. But I'm looking at that basic plan. Under the state plan, the county would pay 88% of the premium, the employees 12%. But under that basic plan, if for all practical purposes, we don't have providers to provide that service,
Well, we do, Green Branch Dental,
except,
or you can go to Iron River or Ironwood.
well, for all practical purposes, if I want to go locally, it's difficult.
It's difficult,
And
yes.
so a question I want to ask the administrator and chair outside this meeting and before the county board meeting on the 29th is, we don't have the premium here, but that select plan, our chair mentioned he's paying $31 or so a month, but he's in a group of retirees, which probably is a lower rate than younger people.
Right.
So if we find out what that rate would be, and
Employees have that. That's been sent out to them. They all have it. It's just in a different.
do you have it handy? Does it have it right there?
Yeah,
Oh,
there we go.
so the select,
So the Select Plus for a family is 6620 and 2160.
I will just comment that even though providers aren't necessarily covered, preventative care, at least with my state plan, preventative care at dentist is still covered. It's just you're going to pay a little bit more because there isn't the agreement of what they're going to pay. They're only going to pay so much, but you can still go to any dentist and get that preventative care. At least in my experience with the state plan.
And just to add on to that, if you read the Delta Dental PPO and Premier Providers in network, I think if you can just validate what you said, is that I'm not sure that's correct. I think because we have Delta Dental and Green Branch is also the only approved, but I go to a different one and my preventative stuff is covered at a higher cost. But I think that's a very important thing for our employees, because if Green Branch isn't taking people, like, you're not going to want to send them to Iron River, North Lakes. That if you live in Ashland, that's just not feasible. So I think what Pat was maybe saying is looking into seeing if we can get additional local Ashland dentists as that preventative's 100%. Can we look into that? Or is that outside of our scope here?
No, it's within the scope. So my basic thought is if we're paying for the more basic plan and yet it's hard to get that service for a lot of people and there's a lot of traveling, that's not practical, is if we looked at a plan where the county contributed more so that we could use more of the providers that actually will take patients, that would raise the costs for the county. County is going to be paying 88% of this, whereas right now the employees are paying 100%. So the county share would go up, the employees' share would go up a bit too, because, but it's only 12%, whatever the premium turns out to be. But roughly speaking, if we make the switch to the state plan, the county is going to have, for the next 2 years, the surcharge, the $750 for family, $300 for single. But then after that, the county will save, compared to the other choice we have, the county would save about $422,000 a year on insurance costs by making this switch. And so the question I would like to look into is, would it make sense for the county to pick a plan where the dental service is something more than the more basic so that people can actually get to a dentist? And we essentially are saying, instead of the county saving $422,000 a year, starting 3 years from now, insurance, we're going to be saving something less. But we're still going to be saving, and then the employees would have better overall insurance than otherwise. So
We're not allowed to do that. We are only allowed to pay for the uniform dental. We can't pay for the select plan or the select plus plan. And that's by state statute. So if people would have to do that. Now we can call, Bayview Dental and ask them if they accept the normal plan. But again, normally this is a deal that a small business cut with Delta Dental. They don't want, if they think they're getting underpaid or undercharged, they won't accept that insurance. It's just that simple. And that's a
Again,
problem with dental.
Again, Delta Dental is going to pay them, let's say $80 for the visit. They might charge 120. Well, you're going to pay $40 more. That's what's going to end up happening, is you're going to pay more for the visit, but
Yeah.
80, whatever Delta Dental is paying Greenbrier is that part is going to be covered at these other, at least with my state plan currently. You can go
Right.
anywhere and
I
a
can-
certain proportion is going to be covered 100%.
So I can definitely call the provider and ask them, because that's the only way you're really going to know is if you actually talk to the provider.
yeah, my last employer, it was the same thing. You'd pay the difference, and they still took us. So other questions or comments from the committee? So at this point, if the rest of the agenda probably is going to go fairly quickly. At this point, does the committee want to ask if any members of the public would have questions specific to the decision guides that the administrator just went through? Mr. Ellison,
I would like to turn it over to the public now, asking comments about this.
is there a second?
Ron will second.
All in favor?
Aye.
Opposed? Motion carries.
I just have a point of order. Is
Yeah.
this the public comment period now?
No, this is, I believe I said specific to the decision guides that you just went through. Questions about the decision guides themselves, the two documents that you just went through, related to the benefits.
All right, I just know Mr. Berlin may or may not want to comment on the budget. That's why I'm asking.
Yeah, no, this is just specific to the two decision guides that you went through.
Okay.
Go ahead, come up to a microphone, so, and then turn it on, please.
My question is, do you think it would help if, for the dental, I'm going, like the conversation we just had, do you think it would help if the county went to say Lakeview or Bay Dental and said, we're putting the whole county on this plan, would you consider? Because I'm thinking, I know Dan, you said like, it's just, they don't want to take that little amount of money because they're a small business, but maybe there's nobody in this area that has this plan. And now all of a sudden, all Ashland County employees and their families are going to have it. Maybe they would reconsider possibly taking that if we approached them and let them know that that's going to be a change happening.
Yeah, yes, we can certainly do that. And that would be a question going along with what Mr. Ray was saying. Would they still accept it and just, would the employee just have to pay more? So.
Karen?
Can you hear me now?
Yes.
Okay, as long as Kelly just mentioned about the dental, could we put another question out there is, in my searching, my dentist is not in there either, so I'd have to go out to that Select Plus plan. Was there any questions brought up in regards to pre-existing conditions with dental as we switch over?
I know with healthcare, you can't.
Yeah, if you could just maybe,
I don't know, under healthcare, under the Affordable Care Act, you cannot discriminate against pre-existing conditions.
okay,
Insurance has to accept you.
okay.
Somebody named iPhone.
Hi. So
Can you please state your name?
it's Alex. My
Alex.
understanding of reading all the documentation signed as an employee of the county for the Delta Dental is that the county, when you're enrolled in the health insurance, you're enrolled in the uniform dental plan. However, anything above that, the county employees pay for themselves. And the uniform plan is only PPO, whereas the Preventive Select and Select Plus would be premier providers.
Correct.
Okay, so that's contradictory to what was said before, so I just want to make sure that I'm understanding correctly. If I choose the preventive plan, I am paying for that premium out of pocket, but I have a greater network to choose from for a provider.
Yeah, that, if you look at the website. Sorry. Can't. Too many screens. If you look at the net website, it tells you what providers are available. You have to choose between here.
Yes, but the PPO is the uniform plan.
Yes.
Anything above that, the preventive, the select, and the Select Plus are all premier providers. So you'd have to do the Delta Dental Premier. So
Right.
the county employees would be paying for that premium out of
Yes, they
pocket
would.
on top of the health insurance.
Yes, and that's what was said earlier.
Okay. And then the other question with that is the premier or the preventive plan on this form from Delta Dental says the option is only available if you're not enrolling in health plans. So at that point, do we need to not be able to use the preventive and have to choose a Select or Select Plus?
That is a question the clerk has sent to ETF. She's out of the office yesterday and today, and so she gets back in, we will send that answer to everybody.
Okay, thank you.
Just checking if anybody else online. Jen?
So looking over the, was it the enrollment guide document where it details each dental plan, the uniform dental and preventative plan in the in-network providers column, it says Delta Dental PPO and premier providers. Is that correct?
What's written on the forms is correct.
So that would mean that Green Branch and Lakeview and Bay Dental would be covered under uniform dental. If I'm reading this correct.
Yeah, you have to, whatever the forms are correct,
Okay.
but we'll still call the other ones.
Yeah, I think it'd be a good idea to call the providers, but
Correct. I think that's my question I asked to validate that because it says they're covered for preventative. So this conversation is mute.
And that's what we're calling to make sure.
Other questions? Mary Jo?
Well, you guys just answered one of my questions, so thank you. So just another thing to consider, I mean, for the most part, I think this looks good, but many providers, one thing to just consider is that many providers are not accepting new patients. So for any employees that their current doctors or providers are not covered, they're gonna have to make a change. And they might not have the ability to make a change easily if providers aren't accepting new patients. So that's something to consider. And then also, I do know there's a number of employees, which Dan already brought this up, that have college students that are still covered under our health insurance that do not live in the area. So there's some kids out of state, Colorado, Minnesota, other parts of Wisconsin. And so that needs to be considered too. And I know you mentioned like they could come back, but you know, if you have a child that's in Colorado, they're not going to be coming back to go to a doctor. They might not have a vehicle. And I really don't know how many employees this would affect, but it could affect a large portion of employees. And then my other question was answered with the dental. So thank you.
Mr. Ellison?
Not to refute that, but at some point, we already have these employees with their kids on our insurance plan. And so that's something that's already, is it changing that much, I guess, with this? Because I think there's sometimes these questions, but, and the other thing is on that part, you know, at what point, and you said it could impact a lot of employees, but we need to know, you know, like how many employees is that, right? I don't know. And I think that will be helpful as a board to understand. Because when we make a decision, we don't know sometimes. So that would be helpful.
So this plan covers 30 counties in Wisconsin. There's 72 counties. So any student that's going to a UW school that is not in one of the 30 counties, so like Dane County, Madison, Milwaukee, La Crosse area, any student going to UW Minnesota, the Twin Cities, that's not covered. The only counties covered in Minnesota are Cook County and Lake County
St. Louis.
and St. Louis. So up around
Duluth.
Duluth, Two Harbors, and then surely any students going out of state. You know, I don't know. I only talked to 3 employees. There's 3 of us that are affected.
What is the current plan covering out of state? Because there's a lot of plans that are local only, and I imagine that our current plan.
Well, we have an expert on the current plan sitting here.
Yeah, I can chime in if you want me to, Dan. So currently, so with the current plan, because you guys have access to national networks, students outside of the area or any employee for that matter outside of the area can look at that national network and find an in-network provider pretty much across all, at least the 48 contiguous states.
Mr. Murdock?
Yeah, one of the things, the reason the state maintenance plan is offered in our county or those other counties is because the state looked at it and said there weren't enough providers. So the Dane counties who have lots of providers, as Dan said, but if I had a child out of state and they were needing medical attention, the first thing I'd do is call the health insurance company. I have never been denied a request. I was in Fairbanks, Alaska and had a medical emergency and I called, at that time I had Security Health and I called them and said, what do I do? I'm in Alaska. And they allowed us to go to there. So I would do the same thing with a student and ask the provider, what happens to that son or daughter or child, if they need medical attention, I think the provider would work with that. It's an emergency. At least that's been the past practice. And the dental thing, I'll go back to the dental for a second. You can have dentist Angela, and she takes Delta Dental, but she doesn't do root canals. So you wind up going somewhere else. I'll give a good example. We had to go to Duluth. Delta Dental paid for that, their share, not the whole thing, but whatever the co-insurance was. But that's the type of situations everybody's going to wind up in eventually. Even if you have a local Ashland dentist and they say they take Delta Dental, the basics or the secondary or third, you'll have to ask them, you have a dentist who can do that procedure, root canal or even crown. Some of those dentists don't do things like that. So then you have to ask Delta Dental, who do I go to next? So then you might wind up going out of town for something like that, but.
So, Mr. Chairman, there's also some, we've gone through a lot of the benefits and the positives, but there are some negatives that need to be considered. And Alex, can you please go over the negative aspects?
Yeah, so in regards to if you were to move to a fully insured product like the state ETF local plan, in order to accomplish that as far as claims run out goes, so when you're self-funded, and we've talked about this in previous meetings, when you're self-funded, contracts are a little bit different than in a fully insured market. With self-funding, your current contract will pay for claims incurred for the 12 months prior to that contract kicking in through claims incurred December 31st, 2024. In order to make that move then to a fully insured product, you have to elect the terminal liability option that's built into your stop loss contract. Terminal liability is a way to actually extend your current stop loss contract through March 31st of 2025. It does come at an expense, obviously. You've got to pay for those 3 months for admin costs and the stop loss premiums. And then, of course, the big question, the unknown variable is what does the claims run out look like from financial responsibility to the county? And that's a little bit more difficult. So in terms of once you make this decision, what we can help with is we can start looking at incurred but not reported data to kind of estimate what the potential liability for those 3 months, any claims that were incurred in 2024 but aren't hitting the self-funded system until after January 1st, but before March 31st of 2025, what that would look like. Just based on what we know right now as far as the admin costs and extending that contract, not including any runout claims, you're looking at being around 220 to 250,000 for the medical and the prescription runout claims.
And you had mentioned something about Scout RX too.
Yeah, so taking Scout RX into consideration because of their contract and the way that it's situated, they have a termination fee of $15,000, and then they require you to pay for the specialty cost savings that they're generating for up to 1 year after the contract ends. So if employees are continuing or had those medications under the current contract where they're accessing Scout's core services and the county is realizing those savings, Scout will bill you for 1 year following that. And so based on our estimates right now, including that $15,000 termination fee, that's around about $50,000.
So about 300,000 plus runout costs.
Correct. And here's the thing, if you make the decision to go fully insured, that's when we can start getting a lot more accurate on the numbers. Obviously, we've got to start diving into employee contract count. We got to look at the admin cost, and then we can start building out that incurred but not reported data set that'll help us refine those numbers.
Other questions, comments?
Pat, do you want to explain why we're even considering this? I mean, I think employees
Sure.
should understand why this is even being considered.
So in the agenda, do you want to pull up the document that says health insurance -2, 05A dash health insurance -2?
Yeah. Shoot, I lost the screen. Hold on a second, please.
Friday, health
This one.
yes.
Okay, let me share a screen on that. Why is this not coming up? Okay.
So as we started looking at health insurance earlier this year, Ashland County has to consider, how we pay for everything. So the health insurance and employee wages go on the general levy, and the general levy can only be passed or increased with a referendum. Ashland County can only increase the general levy by the amount of net new construction each year. And net new construction is the new construction that goes on the tax roll, less any construction that was removed, such as an old building or was moved to a nonprofit. Last year, Ashland County had the lowest net new construction rate in the state at 0.58%. That means we can only increase our general levy by 0.58%. The state average was 1.7%. So we're typically either the lowest or second lowest, sometimes third lowest out of 72 counties. So what it means is for Ashland County, our ability to raise the general levy absent a referendum is about as low as it comes in the state. And we need to raise if we're going to give pay raises of 2.5% and maintain good benefits, somehow we have to come up with that money. So Ashland County has had 2 referendums, 2018, 2021, both failed by roughly 60-40. So what that means is for the county and the finance committee in particular, it gets harder to come up with the money for wages, for benefits, and maintaining the level of staffing that we have. It gets more challenging. And so as we were looking at healthcare, which is a significant part of the budget, one option is to consider going to the state plan. And if you look at the rates for the employees, whether we stay with the current provider or switch to the state plan, they're pretty similar in the coming year. Right now, the employees are paying for the dental. In the state plan, the county would contribute 88% towards that. So for the employees, I think it's a reasonable question to say, why are we switching when the costs are about the same? But if we switch to the state plan, the county has to pick up some costs, some of which Alex just mentioned. And then we have this surcharge for single in the first year, 300, and then for family, 750 in the first year, and then the second year, half of that. But if we look at the state rates for single and family plans, 3 years from now, without those surcharges, based on current rates, the county would save over $400,000 a year on health insurance costs. But we've got some costs in the interim that we have to incur both to buy into the state plan. As Alex mentioned, we have the run out from the current plan, meaning paying the bills for the plan that would end in 2024, and then the things that he just mentioned. Those are significant amounts of money But if we make the change and incur those costs at this time, then 3 years from now, we're about 400,000+ better off on our budget on healthcare, which then, when the finance committee is looking at, can we afford to give raises? Can we continue to give the same benefits? Can we continue to have the same level of staffing? When those questions are answered, the finance committee will be in a much better position to say, yes, we can continue to do those things. So while the short-term transition takes, I think it's fair to say, a rather large commitment on the part of the county. And personally, I think this is our biggest commitment this year if we make this switch, because to swing this, we're going to use the rest of our ARPA money that has to be expended by the end of 2025 anyway. That doesn't go towards this to make this transition. It'll be used for something else. And my personal feeling is if we don't make the transition to the state plan this year, it will be much harder next year. We won't have the ARPA money, and we're giving 2.5% raises. So relative to our net new construction of, if raises are 2.5% and net new construction is 0.58%, we lose a couple percent right there. So it would be much harder next year. And then after that, it's really hard to predict. But what we do know, with net new construction so low, and so far in Madison, them not doing nearly enough to help counties function, we're an arm of the state. We're supposed to do all these things that are mandated. And then we'd like to do a little bit extra on some things. So somehow we have to look long-term and consider what works best there. I do recognize that when insurance changes, it impacts people differently because everybody's life is different and healthcare needs are different. I understand that for some, this is fine and good and looks better. And then for others, there's parts that won't be so attractive. I've been through that, so I just want to say I recognize that. And the other thing is, there's no guarantee we stay with our current provider. I'm old enough that I've changed, partly because I've worked in different places. I've changed providers enough times, and the county might change providers in the future. So having to find new providers is often something people go through, although I would expect with the state plan, if we went to that, we'd likely stay with that because the rates are going to be lower than otherwise. Once we make this investment, then I think people would have those same providers, provided they still are part of the state plan. So, and then the other thing the administrator and I've discussed along with the chair is, prior to a few years ago, the county was undercharging employees for health care. And so we run up about a $1.3 million deficit. 90% of that the county owes to itself, but the other 10% should come from employees. But a lot of the employees who benefited from being undercharged are no longer here. So it's a bit unfair to charge current employees, especially the younger ones who didn't receive the benefit of being undercharged, to pay for that. So the other thing that we have discussed is the administrator would like to bring to the finance committee writing off that 1.3 million, which means changing our accounting, and then saying we're not going to charge the employees for that 10% of the 1.3 million. We're going to write that off, forgive that.
Forgive it, yeah.
And then, as part of this transition. Any questions or comments related to that?
I'd like to explain something.
Okay.
I think the concept of levy limits, a lot of employees don't understand. So back when the Walker administration first started, and levy limits actually started earlier, but there was still there was a growth allowed in levy limits. But under the Walker administration, one of the first things they did was install levy limits for schools, counties, cities, towns, villages. And how they decided to pay for it is Act 10, which made all public employees, well, there's no unions for one, but two, it also made public employees pay more for retirement and healthcare and such. And that's how they paid for it. The levy limits freezing. So what they did is our levy is frozen at what it was in 2012, plus any net new construction. So essentially we've been running on money hasn't kept up with even just normal rates of inflation. Now it's a credit to the staff here that you all have found out a way to keep doing what you're doing with really less money. I mean, that's a gigantic credit to everyone. But the reality is everybody's getting squeezed now, and they're getting squeezed hard. It's inflation this last time around has just really taken this wind out of our sails, and it's going to make it much more difficult in coming years to do anything if something doesn't change in Madison. And of course, given the track record of Madison, nothing's going to change. But you look at the city of Ashland, they're facing a monstrous problem. They have they got to find $600,000 to balance their budget between now and the end of November. Right? That's hard for a city to do that. Every town in the county, every town, city in the state is in the exact same problem. City of Milwaukee is in terrible shape, even though the state legislature let them have a 1% sales tax. They still can't meet their obligations because everything has gotten, prices have gotten so much higher, and the state makes us pay for everything. A great example is judicial fees. So when somebody goes to court and they have doesn't matter what ticket is, they get a fine. The state keeps 70% of that fine. Meanwhile, they still make us pay for running that whole court system. We still have to pay for the clerk of court's office. We still have to pay for maintaining the courtroom. We still have to pay for the DA staff. We still have to pay for all that stuff. We have to pay for the child support work to go to court. To get and then when the fine is there, state takes the money anyhow. So they take our money and then tell us what we have to do, even more so. So it's really gotten to the point where it's just harder and harder and harder every year. And, we don't have a lot of net new construction here. I know there's a house being built on Sanborn that will go on this. So that'll give us, $1,000 extra next year. But, but it really does come to that because we don't have the growth up here. Do we need more housing up here? Sure we do. But developers don't want to come here because they can't get the bang for their buck that they can in Dane County or the Fox Valley. So we have to be creative in what we do and try to do things. And I know that's going to be a topic for more future finance committee meetings. But levy limits really are what's hamstringing us. And again, it's what our levy was in 2012 plus any new construction. So if you're growing by 0.6% a year, that's not a lot of money. So when departments and employees, when you're asked to make some cuts in years, that's the reason why we don't have the money. We're trying to give everybody pay raises. We're trying to make sure the residents of Ashland County get the services they need and deserve. And so we have to get creative. And one of the ways we can do that is help the future is by switching insurance. It's not going to be good for some people. I'm going to admit that. It's going to cost them more, or it's not going to work out well for them. Other people, it's going to be great. Other people are going to love it. And to those employees listening, if you have friends that work in Bayfield County, ask them what they think. Bayfield County made the switch a few years ago. And so you can get firsthand knowledge of what people who are on these plans actually think. Again, it's not going to be good for everyone. And honestly, there's nothing we can switch to that's going to make everybody happy. There are some people that aren't happy with the current plan. That's just the way it is. And we can't make everybody happy. We never will. It's impossible. So,
Mr. Olson?
So I started on the finance committee my first term, and we've been talking about health insurance with M3 at length. We've spent, I'd say, the most topic on health insurance, trying to crack the nut. M3's been I think a good partner. I think this year we finally raised our rates to the point where we're in the good. But I think just so employees are hearing this, this decision was not made quickly. It's been coming over a long period of time. The other piece that I didn't hear enough of is the self-insurance plan has a high level of volatility. As a county that's trying to get ahead of ourselves with finances, we need to alleviate that volatility, and the state plan will help with that long term. So yes, like Dan said, this will not benefit everyone all the same, but as a stakeholder in the county, I feel like this decision has been thought through long term for the county, the employees, all the stakeholders. This should be the right decision, but it's going to be something that has to play out.
The other thing to consider is because our group is so small, we have 126 employees on it and their families. As Mr. Ellison said, there's a lot of volatility. We're lucky. We had a good year. No major surgeries, no cancer, no heart attacks, no any of that stuff. It costs huge amounts of money. That's not going to guarantee the next year we won't have that. And in fact, it's something catastrophic is likely to happen. That's what the odds are. And when that happens, we're going to have to raise the rates of our plan. So you're going to pay much more in premiums. You may end up paying more deductibles. The reality is going forward, our current plan just may not be sustainable. And its rate of inflation is going to rise faster than the state plan. And that is solely due to the size of the pool. We have 126 families on ours. The state plan has every state employee plus local governments that joined it and every state employee and all retirees. The pool is just much bigger, so the risk is much less. And insurance is a numbers game. The more you can spread the risk, the more benefits you can get.
So this is Pat. What the administrator, Mr. Ellison, just spoke to is the size of the pool. So in a very large pool, even if one or several people have very high costs, that's spread out to more people, and therefore it's more predictable what the average cost per employee is going to be in a very large pool than a much smaller pool, such as the size of Ashland County. And because the state has such a large pool relative to Ashland County, when they work with providers, the rates that they can get are going to be better because the average cost is more predictable. So both mentioned the variability there. And so the insurance companies are going to want to protect themselves, against the odds of, having several employees with high costs and not being able to spread that out among a larger group. So the state plan has lower rates because the size of the pool is larger. It's just the nature of the actuarial work with insurance. Going back 4 years, when I started on finance and we looked at insurance, there was two things that we looked at initially. One of which is we're undercharging employees. We're running this deficit. And if you remember the referendum from 2021, one of the reasons for the referendum was to ask the taxpayers to help the county reimburse for that shortfall that we were undercharging for healthcare. And the residents of the state said no. They said no to the referendum. So asking the taxpayers to take care of that was a no. We looked at switching to the state plan then, quite quickly, about as quick can be. We found out we were in no position financially to make the switch to the state plan. We couldn't at that time cover the costs for making that switch. So that option had to get taken off the table right away. What we were able to do was to raise the rate so we weren't running the deficit like we were. We built up some surplus. That was a positive thing. But we also, some of us that were around 4 years ago, kept the state plan in kind of in the back of our minds to see if we got to a point where we could make that switch. And at this point, working with the administrator and the chair and the staff here, we can make that switch. And I think when I say that's a big commitment, it is a big commitment. But 3 years out from now, we'll have something over 400,000 more in the budget to work with. And that, if the state doesn't change things, puts the county in a much better position to maintain the level of employees we have, the benefits they have, and to give raises. So it's to get through that. So 3 years from now, we can do those. The county, in less than 3 years, will recover the costs for making this switch by what the county portion will be that much lower than if we don't. So it'll take us 3 years to recover the employees. Your costs are about the same as the current plan, but bear in mind, next year, instead of the 30% premium surcharge, which is really 300 single, 750 family, next year it'll go down because it'll be half that. And then 2 years from now, you won't have that. So your rates are actually going to go down. And then the county, in under 3 years or so, we should recoup through a lower cost for us so that we have the capacity to do the things that we need to do for employees. So, any other questions or comments related to this? Okay. So we've looked at health insurance. There's a number of documents in the packet for the meeting today. We've gone through most of them. A couple are, I would interpret as background material for the discussion we had. Is there anything else that we should cover related to this? Any questions? And then if whether committee members, employees, or others have questions or concerns, you can email the administrator those questions, concerns, and then we'll look at those and try to get answers, et cetera, as quickly as we can. And then the county board meeting October 29th would be the
Absolute final decision.
absolute final vote regarding the healthcare and the budget.
So I will, as I get answers to those questions, they will be sent out to everybody on the same email train. That way, everybody has all the information in one email train, and they can just scroll through it. Everybody gets the exact same information. There's no, I heard this, I heard that. Everybody's hearing the exact same thing. So I just want to make sure everybody knows that. And I will, Finance Committee will be copied on that email too, as they have been.
So as employees now, the open enrollment ends at the end of this month.
Yes.
And so at the board meeting, we're gonna vote to go this way, but they've already had to use the open enroll, right?
Right. They have all the forms to fill out to open enroll.
Okay, so they're planning as if the open enroll is through the state plan.
Yes.
Okay.
Yeah, if for some reason the county board decides not to move, then nothing changes. You just keep, your current plan just rolls over like it normally would. And Karen has a question.
Karen?
Sorry, I'm not used to doing this from home. I just wanted to make a statement that I appreciate everything you guys are doing to try to save the county money. And this is just a lot of information that has been sent to the employees to fill out forms and have returned by October 31st. We've got a lot of data that we need to go through, and it was sent to us, but the only feasible one that we can pick is the state, because most county employees can't afford the other options that were given to us. I've been doing some research. First, I had found my doctors that I needed in it, and I was pleased with finding it. Then when I did the search engines in the forms that were sent to me, my doctors were not there. So last Friday, I did make a phone call and spoke to someone at the state named Jenny, and my doctors were not there. Now I've been supplied with information that my doctors are there. I am only one out of all these employees. I also did research in regards to prescriptions and the generic drugs. They are also not covered. My dental is not covered. You guys are making a choice for all of us. I do appreciate all that you're doing, but I do understand all the things and what you've explained to us, but I just want y'all to realize that there's a lot of employees that this may not benefit. Thank you for your time.
The Finance Committee voted to approve switching to the state plan at an earlier meeting. Executive Committee after that approved switching to the state plan. And I think at this point, it would be good for this committee to reaffirm the vote going to the state plan if that's what the committee so chooses.
Brad will make a motion to reaffirm that we should go to the state plan for health insurance.
Is there a second?
Ron Stender will second.
Any further discussion? All in favor?
Aye.
Opposed? Motion carries. Thank you. Next, we'll go to the public comment period. And this could be public comment on anything.
Yeah.
We have Mr. Berlin in the room. So Mr. Berlin?
Good morning, Michael Berlin, District 12. I have a comment with regards to the proposed 2025 budget. It's come to my attention that we are, or the Finance Committee is looking to write out the AARDC, Ashland Area Development Corporation, of $50,000, which was in the 24 budget and not going to be in the 25 budget. I know that when we sit on this board, and I've sat on this board, we take a deep look into the decisions that we make, and not getting too deep into the Development Corporation over there, but I think they're a vital part of Ashland County. And some of the $50,000 that we have given them in the past has not been very transparent. And I'm not sure whose fault that is, if it's the Finance Committee, the board, or Carver. Let me just say this. I believe in my mind that it's a combination of transparency between the board and ARDC, Ashland Area Development Corporation. And perhaps if we held his feet to the fire here a little bit in reporting back to us on how he is spending that money. All this is benefiting Ashland County, as in, i.e. the 23 fiscal year. He had serviced over 200, I shouldn't say he, but the Ashland Area Development Corporation has serviced over 200 future entrepreneurs in Ashland County. In 2024, it's expected to excel the 200 future entrepreneurs here in Ashland County. And when we talk entrepreneurship, those are businesses. And once we, assist in businesses, that's another tax, another form of taxes coming back into Ashland County, which is pretty important because we're trying to make money. We're trying to pay our bills, as we just discussed in our health policy or plan that we just discussed. I'm kind of putting in a plug here that perhaps if we can't see giving these guys or sharing these guys with some funds of $50,000, maybe a partial. I do recall being on the board, and we were in a situation with the Chamber of Commerce with Mary. And Mary came back and she justified what she's doing with the funds that we had given her. But let's not take away from the topic at point. Topic at point is I'm supportive of the Ashland Area Development Corporation, and I think they could do better. But how can they do better is transparency to this board, to the county board, for the money that we have in the budget for these folks. At this point in time, I'm not aware of the contingency or when this money is awarded to these programs, what are their commitments to the board, to the Finance Committee, to the county board? in spending that money. What I'm saying is, or what I'm asking here is, when we share this in our budget, in our county board budget, these recipients are mandated to report back to us, or what are the rules for expenditure of this money? Obviously, I don't believe the money that this board gives any program, that money is not audited by that program, giving us, the board, the assurance that this money is being spent in accordance with the intent it was given. Am I correct in that aspect?
This is public comment, so we can't discuss.
Oh, I'm sorry.
Yeah.
I'm sorry. And I mean, these are questions that I have in my mind that I think we could do a better job. I think they can do a better job. Thank you.
Is there anyone else for public comment in the room, online, or the phone? Is there anyone else in the room, online, or on the phone for public comment? Anyone else in the room, online, or on the phone for public comment? Hearing none, we'll move to the next item.
All right, so we have the 2025 budget. It's been balanced. I need to thank Sue Mission for all the hard work she did. Sue did thank you, Sue. She did a whole bunch of work on this and helped really get this balanced. So we as the last meeting, we were down 240,000. Sue and I went line by line and found the $240,000. So I present to you the budget.
And I want to say the first time the administrator told me where he was at on the budget, they were over 2 million that they were trying to figure out. And so I do want to recognize, acknowledge our administrator, our staff, Sue, department heads, as they've worked through this process. It's been a long process. Our consultants, Mike and Steve also. And I think they did a really good job of working together, listening to each other, making sacrifices, going without here and there to bring this together at the point in time that it needed to be brought together. And yet the county is still doing, what the county needs to do, the state mandates and some other things that we think are important to do. So it's all of this sort of stuff that I wish the public understood better, because there are an awful lot of good things that get done by the county. There's a lot of issues the county works through. When roadblocks come up, the county's finding a way to get through those. Too often the county doesn't get recognized and the employees don't get recognized for all the good things that they do. And pulling this budget together, not an easy thing, but a lot of working together. So I'm really happy with how everyone was able to work through it and pull that together, despite some of the harder choices that needed to be made. Questions, comments? I assume you'd like us to approve this.
Yes, sir.
Do we have a motion to approve it? Mr. Ellison,
Blake will make a motion to approve the budget as presented.
Brad will second.
any further discussion? All in favor? Aye. Opposed? Motion carries. Thank you. Going to the next item. We have a grant update.
Okay, so this committee asked for a listing of all the grants the county applies for and receives. So Erica contacted every single department and got it all collated. I know it's really hard to read on the screen, so those of you who actually have a computer are gonna have to enlarge it. I can't really do it on the screen. So I'll let her take it away. This is going to be a running list. So as new grants come in, or they will be added to it. as like land conservation is a great example. They go through different grants every year. Grants will be taken off because one ended and then a different one went on. So this will be available to the finance committee at whatever interval you guys decide, but it will be available always. So Erica, if you want to take it away.
Thank you, Dan. So the turnaround time that I gave departments for this was pretty quick. So you'll probably notice that both child support and health and human services are not fully represented here at all because they are just under incredible stresses at this moment, and it's also budget season. So we will continue to collect those, and I will continue to encourage all departments to keep updating this. I'm happy to answer questions if there are any. Otherwise, I do have that follow-up question for the Finance Committee, and that is, at what intervals would you like to see this? Because I will intend to keep a running list, but I think it will also be necessary to contact departments perhaps twice a year to say, are all of your grants input on this spreadsheet so that finance can take a look at it, right? And so if that seems an appropriate kind of period to do that, then which 2 months of the year should we plan around, perhaps, if that sounds appropriate to you all?
Questions, comments? Mr. Olson?
So thank you for doing this. I think this is a good step in the right direction. I think when you add new ones that are new, obviously highlighting those that are not. So a lot of these I think are existing or have been old. Another one would be just ones that you're working on.
Okay.
Just saying, hey, this is where you're involved in some of this,
Okay.
just helping us. And then obviously as you go forward, we're going after other grants now too. I think some of that, those are kind of the updates. I guess I would
Okay.
rather have from you, like telling us exciting things or things that maybe didn't go the way, just those kind of updates, not just this because I'm excited to have a grant writer. We've been talking about it. As we talked about some things with AADC, I think, that was a discussion that, hey, so economic development, when people say we're not doing it, I would disagree wholeheartedly. I would say now we've got a grant writer. That grant writer is 100% economic development as far as I'm concerned, because every dollar that comes in is out of the area. So those are things that, again, I'm just looking for from you.
Mhm. So should I keep this all in one place, or should I perhaps keep 2 spreadsheets or 2 sets of reports? Because this was meant to be only the grants that we actually have so that you could see the hard numbers of the money. But we could certainly we could either change this particular spreadsheet and ask departments to upload what they might be applying for. I think that is probably a big ask for especially Health and Human Services and a couple of the larger departments who are just constantly in the churn of applying for things, and some of them don't happen and some of them do. Perhaps the other option is that, like, I just keep a side track for what I am working on to present to all of you, and that could be updated 3 or 4 times a year if you would like to see it more often than twice a year. And I'm certainly happy to talk about what I have been working on for the past 2 months quickly, if you'd like me to, today.
Yeah, actually, could you, for the benefit of Mr. Berlin?
Yeah.
Yeah, just a little back history for you. Mr. Berlin was the driving force getting us to hire a grant writer. So he's really the reason why you're here.
Right.
So
Thank you.
For his benefit, maybe you could tell him what you've been up to.
Yeah. So I was hired in a part-time capacity in July. I turned full-time on August 5th. And since then, the big projects that we have deposited or turned in was a DOT charging and fueling station grant for, I believe, 11 or 12 electric vehicle charging stations across the county. And that project focused on sort of the two main corridors for the county. So Highway 13 all the way down to Butternut, and then across Highway 2, adding a bit more coverage. Because currently we only have 2 public charging stations in the entire county. And that is, it was a significant, now the number is not going to come to me. I'm going to say it was probably 1.5 million that we applied for. That was available to us because it was a DOT opportunity. It was a federal grant that was possible. It was offering 80% of total cost of construction, and the other 20% was something that Xcel Energy was willing to cover for us. So this is, except for my time and other people within the county who would just manage what would come from this, if we get this, the county is paying nothing for this, for significant infrastructural updates for EVs, green energy, these sorts of things. Just yesterday, so that was submitted at the end of August. I don't expect to hear back for 4 months, 5 months. I mean, we don't know. They don't sort of set a time limit about like when exactly they will get back to us, although
Next year sometime.
it usually takes some time.
Yeah.
The second opportunity that I submitted yesterday is not a direct grant opportunity, but it is a federal planning and technical assistance opportunity, which I felt would help us build the runway for applying for much larger grants throughout the entire county for the foreseeable future. And so that technical assistance and planning opportunity grant is coming from the EPA, and it is, we needed to sort of set up a particular space in a particular area to plan something that would tie together the ideas of what we would want in terms of building more rural recreation opportunities, outdoor recreation opportunities, and tying them with main streets in the county. So how do those two things fit together? What kind of plans can we come together around? And I felt, and other people that I immediately spoke to when I found out about it, Sarah Hudson, Carver, several other people across the county said, yeah, that sounds perfect for us. So Lissa Radke and I organized a meeting, and almost 20 people attended across the county to generate ideas and generate plans. That was due today, so it was all in a quite short timeline, and it was sort of spectacular, the reaction that we got. And what we decided to do after we had the larger public meeting is to focus the opportunity application around the Glidden area townships specifically, because they sort of had the most already well-stated and well-dreamed sort of ideas for what they would like to do for that area. But also this plan fit what the rest of the meeting across the county, everyone was in agreement about, is that we would like to build more kind of adaptive and kind of all use or multi-use trails across the county for ATV, UTVs, snowmobiles, bikes, and hiking. And we would also like to sort of coordinate a kind of like branded signage system so that people, when they come to Ashland County, they would know you're having an Ashland County experience, right? That we are a rural recreation sort of gateway. that we can tie all of this together. So that opportunity also required, a number of letters of support. We had 14 different entities, businesses, development corps, everything else kind of come together, Chamber of Commerce. So a lot of excitement was generated around that. I think what this also perhaps helps us do if we win this opportunity, and honestly, we sort of have already taken steps in this way, is that I think it helps show people in the Mid and South County that the North County area cares very much about their development as well. And wants to tie them into all the economic development plans that we might have. Because I know that there is a lot of work around that, but sometimes that is sort of hard to prove to everyone that is at the table in a kind of constant way. And so that was submitted yesterday. Currently, I am working on rewrites and just a bit of recrafting for resubmittal of the EPA Community Change Grant, which would be essentially a $20 million ask of the EPA for a few more charging stations, but also microgrids. So these are the things that Ashland County Charges Ahead and Bill Bailey and Shawamigan Bay Renewables have been working on for a while. Some of those grants have been won and approved that they have applied for in Bayfield County. I think we're really close. We had a good debriefing meeting when we were initially turned down on the earlier application. So that will be resubmitted in a short number of weeks. I'm working on that as quickly as we can because we're not able to get a current figure of how much money is still in the pot for that EPA grant that was initially set at $2 billion. I asked directly and they said, oh, we can't tell you that. We just are keeping the window open. There's some money left. There's money. So okay, we're gonna get it back in there. Just yesterday, I also met with Health and Human Services, helping them out with a opioid treatment enhancement grant that they need to turn around really quickly from the state. Otherwise, I have a lot of other irons in the fire, including housing. I think housing needs its own special moment because I'd like to present quite a number of things that I've collected for you all, because I will ultimately need your guidance about pieces of land that we should focus on and what kind of avenues you want to pursue in that way. Any questions about that or anything else you'd like me to answer?
On the housing, work with the administrator when you're ready to have this on a finance agenda, let him know.
Okay.
We'll put it on a finance agenda. Questions, comments from the committee? Then I got a few notes here. One of the things I think about is story about, instead of trying to help individual businesses or just the new person wanting to be an entrepreneur.
Pat, your microphone does not seem to be working very well.
No, that's me forgetting to turn it on, but thank you.
Thank you.
I'll start over. So the first thing is I asked the grant writer to let the administrator know when she's ready to have this housing topic on the finance agenda. So we'll do that as soon as they're ready. The second thing is, about 10 years ago in the municipality magazine, which is really written more for cities as units of government, townships, they talked about, for economic development, instead of thinking about trying to attract, say, a new big business like a manufacturing company or working with smaller individuals, say, wanting to start a business, what they were finding is that if you want to support economic development, make the community an attractive place to live and work. And then people will come, start their businesses, expand their businesses, move their businesses. But it's first got to be a place that they want to live and work. And that, of course, means different things to different people. So you talked about, you know, the recreation opportunities connecting with, you know, the towns in the city. That seems to make perfect sense up here, both for us locally and for tourism. So I think about trying to make Ashland County that place that we all want to live and work and stay, you know, as opposed to moving out of, and for people to visit. And so there is a role for government on doing bigger things that don't necessarily fall to the private sectors. Roads are a good example of that. In Ashland County, we're doing a good job on taking care of our roads. And the administrator and I have talked. I've had a bunch of questions on highway. That's putting it mildly, I think. And I'm not done with my questions, by the way.
No, it's been very in-depth.
So I think we're doing what we should, when we should, and we're watching the dollars for our roads as carefully as we can. But I also recognize that roads are an important part of infrastructure. If people want to live and work here, visit here, bring their business here, you need good roads. Roads are one part of infrastructure. The broadband initiative that the county is engaged in, we've heard so many times that we need more access with broadband. That's something that really falls to, you know, the county and local units of government more so than the private sector. 4 years ago, when I first ran, one of the questions the League of Women Voters had on their questionnaire, and I filled it out, was how do you keep young people here? And so I got on Google and researched some of that. And one of the things that just jumped out on everything I read was you need internet access, you need cell phone access. And it's partly because young people want to be connected to each other, but they also want to connect to their community, know what's going on, that sort of stuff. And if they're thinking of starting a business, young people more so than those that are older understand the importance of being connected. So as part of economic development, it's also part of keeping our young people here. So we're engaged in the broadband initiative. We're engaged in the solar initiative, which environmentally is consistent with what we value up here, but it also then creates jobs because somebody's got to install those, someone's got to service those. So a couple of years ago, I spent a lot of time looking at considering solar for some property I own. And so, yeah, I know there's companies here that do a lot of solar. So it supports our economy that way too. And so, and then our comp plan update, we'll start that in January. The comp plan update will be a standing committee as opposed to an ad hoc committee. So the board changed it to standing last year versus ad hoc. And the reason for that is a standing committee continues to meet, whereas an ad hoc committee does its work and ceases. So by making the comp plan update a standing committee, then for other items such as climate change in particular, we can continue to have conversations about how do we adapt to climate change. There's a county downstate who's done a lot of that. And so they're working on projects that help the county make that adaptation related to climate change, but other things that are just good economic development or quality of life things too. So as a grant writer, you know, obviously you're going to be pulled into that, and we'll be working with you more on that. So as I think about economic development, I think more and more about these big picture things that the county can be involved with. There is a place for helping individuals get started. More than 25 years ago in the late 90s, when the Larson Picture Frame Company in downtown Ashland, when they moved to what's now our industrial park, it's now Larson Jewel. But the county and the city, state tax dollars, federal tax dollars were invested in that building to remodel it to become an incubator, which means starting businesses and moving them out. They then became an enterprise center, which means trying to keep it occupied, not necessarily starting new businesses, moving them out, just keeping the business or the building occupied. The intent was that with the investment of local and state and federal dollars was that they would then be self-sustaining to provide the services that they provide. So they have the rent from that building, and they got the building and the upgrades, you know, through our tax dollars at different levels. And the intent was then that building provides income to sustain them and doing what they're doing. So we have invested for many years in the AADC so they can do what they do. But it was not intended to be a permanent thing. And it really only started when that Larson Picture Frame building became available and needed to be repurposed. I think what the county's doing now, focusing more on the big picture stuff, housing, broadband, solar, maintaining our roads, things like those are things, again, with that article in the Municipality magazine 10 years ago, you make this a place people want to live and work and visit, then the good things happen on the rest of the economic development because people want to be here. And for those of us who are familiar with Northland College, I live a block from there, we all know a ton of people who went to Northland, came from somewhere else, and they stayed here because, hey, I like this place. So we know we're attractive to people that come and visit, and we want to make sure we continue to be attractive and for people to start their businesses too.
Just one note, if I could add, on the comp plan and its importance for the work that I do, is that, you know, almost any large grant needs you to come up with sort of an overarching reason why, right? You say you have your problem statement, but then you also have your values, and you have where else does this money fit within your plans for the county. And so the language that we put into the next comp plan is incredibly important for being able to make the case that we need money for particular things that we will want. So I'm keeping sort of a running list of phrases, a running list of topics that we might want to make sure that we include in the comp plan as we go forward.
Yeah, good point. Well said. That comp plan is a tool to help us to get those grants. And then as I think about economic development, I haven't talked to the administrator or the chair about this, but I'm well aware that some of the grants that we might apply for will need a match. And so by having some money set aside more so than otherwise, some of that money in contingency, we might say, okay, this is targeting towards something that's related to economic development. And we'll know very specifically what we're targeting then and why we're targeting it. And we'll have full transparency on what's going on. Yeah.
And again, that's something Mr. Berlin pushed when he was finance chair.
And by the way, he can apply for grants that we can't apply for. So he's someone you should have some conversations with.
Okay,
Because he's got no shortage of projects he'd like to see go.
great.
Mr. Berlin? You want to come up to a mic and turn it on? So this is Mike Berlin.
Until just April, I've been on the board. I've been chairman and stuff. But I abdicated for the position that you're in here for a couple of years. Just about 4 years, the 2 terms I was on the board. And well, it exists. We're there. It took some doing, but board members have said, it's not like we've never talked about it. We just can't afford it. And it wasn't until January of this year, 24, the handbook that we get advised the counties to get into grant writers. And it was March of 24 that there was another article in the March that federal monies will become available for not only states, but counties as well. So there we're being set up for grant writers in January of 2024. And 2 months later, it's telling us that federal funds are going to become available to not only the states, such as the ARPA fund, which is a federal grant that came down to the states. And that, that's what, Ashland Area Development Corporation capitalized on. There was a $2.1 million or so. And anyway, and that just goes to attest that funds are becoming available through the feds to us, the counties. And that's why it's important to, and I need to give you just a little bit of background. I've been vice chairman of the tribal council for a number of years as well. And prior to that, I worked with the government for 28 years in the engineering with the Bureau of Indian Affairs. And I'm kind of a grant kind of person. Where the money's at, and like say for instance, we talk about transportation and stuff like that. When I was on the board, I was also a member of our subcommittee, our road subcommittee down in Ringo. So talking with Matt and some of the recommendations I made at that point in time, You know, there's gonna be some state funds coming down and they're gonna be looking for, off-the-shelf projects. And at that point in time, of course, I made motions, we got some money in roads, let's get some projects on the shelf so that when this comes available, we're ready.
Yep.
We're ready to go. So, you know, when I'm a checklist type kind of person and I'm also a forecaster. At any, that's just a little bit of my background. And, I'm happy to say that when I'm at a tribal council meeting, or I'm happy today that you are allowing me to speak with the finance committee here, that when I come to a meeting, I'm not recognized as Mr. BIA anymore. I'm a constituent. I'm out in District 12, out here on the town of Sanborn. So, and I've got some of the, what do you call it, attributes that I have in my pack sack. You never know what I'm going to be talking about. I can just, I'm there. And when I'm asked for support and I need to, before I can support anything or anyone, I need to know some background. And boy, I can only say that my opinion is that, and I know we're going to continue to support Ashland Area Development Corporation. But what I would like to see some transition between them and you. But there's got to be some coordination. And this is why I say, if we, and we're not, of course, we just passed a budget. I shouldn't go there, but we need to have a transition period because obviously we need to know, you need to know what they've done, where they're going, what they're doing. Numbers are important. And Carver's not the easiest person to get those numbers out of. But that's what it is. There's ways to do that. There's ways to do that.
Thank you so much.
I'll quit. Thank you.
Thank you so much for the information, Mike. I will be following up with you for sure. As a side note, Carver and I have known each other actually since we both worked at Northland College. So I have been working with him quite a lot. And yeah, I know that some challenges remain, but it would be very fun to coordinate with him some more. Yeah, thank you. Okay.
Well, with the grant writing, my understanding is you're anticipating working with different organizations, units of government throughout the county. So there may be grant opportunities where there's something that's attractive to the county that would make sense to partner with any organization, whether public or private in the county, to work on that stuff. And it could be someone else brings you something that you then work on with them. So there's always that possibility. Anything else related to county grants?
If I
Mike?
may, I'll just make a suggestion, and I've been pro on this when I was on the board as well, to try to partner with the Bad River Tribe. Because just for instance, we have received $3 million in ARPA funds, and that's coming to a close pretty quick. And attending a number of tribal council meetings, I have seen people in the audience, we should go to the county and get some of that ARPA funds. And I get recognized. And I says, you know, the county's getting $3 million. Well, let me ask you this question. How much money do you think the tribe is getting? $48.6 million. Why do you want any part of that $3 million when you can't spend what you got? Well, they had a budget, but in working with the tribe in many other grant applications and stuff like that, I think it would be only, it would only prove beneficial for Ashland County. I really do.
Yeah,
Matter of fact,
she's working with Beth Gerard. She is working with Beth Gerard.
Yes.
Yeah, she is.
So at any item last, the reason why I was on the county board, and I was appointed initially, I wanted to work with the county and the city in upgrading the wastewater treatment plant. Because whenever we get any significant amount of rain, 2 or 3 inches of rain, our facility can't handle it. We're floating raw sewage out in Lake Superior. But yet the Bad River Tribe They have a facility treatment plant that processes sewage, and of course it discharges into Bad River. This is gonna take more than a minute, I can tell.
We have what?
And the
Yeah,
thing
okay.
is,
Mike? They're waiting to give shots in here.
pardon?
The staff is waiting out there to give flu shots, so
Blue shot.
we'll try to finish this meeting as quick as we can.
I can just come and meet you.
That would be wonderful. Just one additional thing, just to, so everyone knows, I do contact Bad River with every large grant that I look to see if they would like to partner with us. Yes, with Beth, and then recently also contacting Beth and Philomena. And that's because a lot of these, it would make our application stronger if Bad River was included. Unfortunately for the charging and fueling one, Bad River said they were already completely covered and had as much as they needed, so they didn't need to join with us. And then with the turnaround time on the rural rec program, I think it was just too quick, so they couldn't get back to me. But I will absolutely continue to include and invite Bad River as much as we possibly can in all grant opportunities.
I'll make some time and stop by. Thank you.
Then Eric, and you asked the question, what does the committee want to see in terms of grant activity? I'm going to ask that you work with the administrator and develop some guidelines because I don't want it to be onerous for staff. And then we can have that conversation another date as far as details. Number 6, reports and updates.
There are none.
Number 7, administrator updates.
I just give you one, and again, calling out a staff member, Jen Solberg. She got all the Sanborn tax write-off taken care of and not having to utilize that private service.
Oh, well, that's impressive.
So hats off to Jen.
Thank you. Scheduling the next meeting, do we want to schedule one or do we want to wait until we have reason to have one?
I would say wait.
We'll wait on scheduling one then. Motion
Yes.
to adjourn? Mr.
Blake will
Fulton?
make a motion to adjourn.
Ronald second.
All in favor? Aye, opposed, motion carries. Thank you.